pro-health effects of that thing. There are really nice studies showing that there's also evidence that caffeine can provide brief. In addition to so-called performance-enhancing effects of caffeine, there are also the well-studied and now fairly well mechanistically understood pro-health effects of caffeine. Now here, when I talk about pro-health effects of caffeine, I want to be very clear that if your schedule of caffeine intake, that is your timing of caffeine intake, or anything else for that matter, offsets getting regular, high-quality sleep of sufficient duration, well, then you are undermining the pro-health effects of that thing. This is true for exercise, this is true for caffeine, this is true for supplementation, this is true for prescription drugs. Again, you don't want to be neurotically attached to the idea that you have to get perfect sleep every night, because that's simply not true. But it is absolutely the case that anything, whether or not it's good for you or bad for you in the short term, that disrupts your sleep because of the timing in which you're doing that thing is going to undermine your immediate and long-term health before long. So with that said, there are several well-described health-promoting effects of caffeine ingestion. And once again, when I say caffeine ingestion, I'm referring to that 1 to 3 milligrams per kilogram of body weight dosage. There are really nice studies showing that being a regular consumer of caffeine can help offset some of the probability of developing Parkinson's and maybe Alzheimer's-related dementia as well. These are not terribly controversial data because of the fact that caffeine is known to increase the release of those catecholamines, dopamine, epinephrine, and norepinephrine, as well as acetylcholine. All those neurotransmitter and neuromodulator systems are the ones that are known to be defective in Parkinson's and Alzheimer's, although there are other transmitter and hormone systems that are defective as well. There are beautiful reviews on the neuroprotective effects of caffeine in neurodegenerative diseases. They're quite extensive, and I'll just refer you to one and the references therein, and we'll provide a link to this in the show note captions. The title, as the topic at hand suggests, is The Neuroprotective Effects of Caffeine in Neurodegenerative Diseases. This was published in 2016. I'm sure there have been other reviews since then, but it includes many, many quality references and studies both in animals and in humans, pointing to the fact that specific enzymes that are associated with the health of, in particular, dopamine neurons are made more robust by regular ingestion of caffeine. It also points to the fact that the increase in dopamine receptors that is induced by regular ingestion of caffeine, that I referred to earlier, is another way in which dopamine, however many dopamine neurons remain around in people with Parkinson's or people who are aging that lose dopamine neurons naturally, that dopamine can have its maximal effect because of the increase in receptors for dopamine that caffeine induces. And there are other biological mechanisms that further support why caffeine ought to be neuroprotective, including its effects on the acetylcholine system, which is one of the major systems disrupted in Alzheimer's dementia. So in other words, it makes perfect sense as to why caffeine would be neuroprotective. Caffeine has also been shown to diminish headache, particularly when taken in combination with aspirin, and that's because of the effects of caffeine and aspirin on blood flow. There's also evidence that caffeine can provide brief but substantial relief from asthma. So I wouldn't want people to rely on caffeine as a life-saving approach to an asthmatic attack. That said, for people that suffer from minor asthma, that caffeine intake, again, of the dosages that we talked about before, has been shown to alleviate some of the major symptoms of asthma for anywhere from 1 to 4 hours. And I know this is of relevance to a lot of people out there, because caffeine increases the catecholamines, and in particular because caffeine increases dopamine transmission in the prefrontal cortex, this area of the brain associated with focus and rule setting and context and task switching. Caffeine is known to improve focus and alertness, in particular in people who have symptoms of ADHD or other attention and focus issues.